Hi, I'm Sergeant First Class Tayo. I'm the acting first sergeant here at 593rd.
Hello, my name is Lieutenant Bethards. I am Sergeant Manos platoon leader.
Hello, my name is Sergeant Manasalvas, first name Freddy. I'm doing a introductional. I'm going to talk about back awareness today. And the most important thing that I want to give as a speech is my experience, how I got myself into it. As we know, every day we wake up and we come here to do PT and we do stretches, which is always good, but we always got to be more aware what we like them. Mostly for me, it was my back. And as you guys know, a few of you guys here remember that I got a back injury. I was in the ground, I was crying, and it was painful. Something that it took me time to recover out of it. And, it took me more than a year. It stopped my whole career. And it took me more than, what's it called? It took me more out of me to actually come back and recover out of it. I can explain what I had. What I had was a dislocated disc, or bulging disc, how we like to call it too. Dislocated disc is usually when the gel part of the disc is completely popped. It's completely popped. The bulging disc is when we got a little ball on the disc coming out of the disc gel. Usually for me happen between the L5 and L4 when I have my dislocation. And I'm going to explain in the words of Cleveland Clinic. They say a herniated disc refers to a problem with one of the rubber cushions in your backs, call it a disc. That side between the bones that stack to make the spine. These bones are called vertebrals. So when we have these little occasions that the disc pop or dislocate, it interferes with our nerve system, pushing our nerve system and making us feel pain. There's different type of pains. You will feel like the pulsing pain and the burning pain. Why? Because the disc is actually pushing against the nerve and the bone, which create irritation under our legs. We might not feel it in the back, in the upper exactly side where it happens, but we might feel it in our legs. We got research from Mustafa and Quarakli. Over 85 to 90% of patients with actual herniated disc experience a relief of symptoms within 6 to 12 months without any treatments. So before a person actually do a treatment or decides to do any physical therapy, the patient needs to first be 3 weeks without no pain before we take any action. And that's what I had to go through for my physical therapy recovery. He also says due to the high prevalence of this herniation, the routine neurological neuroimaging of an asymptomatic individuals, the recommendation is to avoid other imaging studies during this period, as the study's result will not alter the management, however. Meaning, like, if I break my disc again, I cannot take imaging at the moment. Why? Because the disc is actually popping out, and it takes from 6 to 2 weeks to actually recover a little bit. So instead of inflamming, it is inflamming. The disc go back to normal, not exactly completely normal, depending on the severe case of the disc. It used to be thought back in the days that when you get a dislocation disc or bulging disc, the answer was immediately surgery. I got in 1998, Aihara, Takahashi, and Yamagato, previous doctors that did our research, specific in the L5 disc, saying that usually the treatment without surgery didn't work because they didn't take the time to actually analyze the situation of that they had to wait. They will do the treatment immediately, and that affects the patient. Something that we know a person now needs to rest before actually getting to physical therapy and treatments for that. We also know that recommending surgeries is usually the worst decision. Why? Because it brings consequences. It brings like side payments. Meaning like In case I would have surgery, I would have like consequences for the future. It would be worse for me than actually me just working my muscles. Alexander M. Daiki says that over 85% of patients with symptoms associated with accurate herniated disc will resolve with the 8 and 2 weeks, like I said. But he also explained us that after those 8 and 12 weeks, we should get X-rays, CTC scans, and MRIs to see how severe can be the dislocation of the disc. For me, how I recover and what I had to do to recover is take the first 3 weeks easy. I couldn't move out of bed, I couldn't walk correctly, I could only be standing for a few minutes. And I'm pretty sure you saw me. Something else that people doesn't know, but I had to take steroid pills, not injections exactly, used to build a muscle mass in my back, so it will like it will not create friction on my back due to the lack of my muscles also breaking in the back. And I would like to say for this class that as we got soldiers and as we got personnel around here, it's important to also share awareness of we always got to take care of backs, depending what kind of exercise we're doing, because the backs is one of the most important part of our bodies. Thank you.